Welcome to Medical News Network, your trusted source for the latest in the medical and dental information making your life better. I'm Mike Wittgenstein, and thanks for joining us. We brought our cameras to Little Rock, Arkansas, to the office of a doctor we first interviewed in studio a few years ago on TMJ, or TMD, the dysfunction of the jaw joint, now known to cause headaches, neck pain, back pain, balance issues, and all too often misdiagnosed as fibromyalgia, and a little bit about snoring or sleep apnea. So my advice, sit back, relax, get comfortable, and we'll see you in a minute.
Welcome to an educational and comprehensive discussion with today's top medical experts. Your trusted source for the latest in medical news and information. You're watching Medical News Network.
Welcome back. We're with Dr. Jolley from Little Rock, Arkansas, talking about TMJ or TMD, the dysfunction of the jaw joint, and we want to talk a little bit about sleep apnea and snoring. Now, when I talked to you, I asked you if we could have a couple patients come out that you had worked on that maybe had gotten better, and I see we had quite a few show up this morning. And I want to ask everybody here, by show of applause, has Dr. Jolley really done anything to change your lives? Really? Okay, well, we're going to get into all that. But before we do, let's take a minute and talk a little bit about snoring or sleep. I mean, when I first talked to you a few years ago, I would have never have thought, and I'm sure none of these people would have, to go to the dentist for a headache. I had neck pain. You would never, that would be the last person I would ever think of going to. And when I heard that now you're helping people with snoring and sleep apnea issues, I was just as, I have to find out. So tell me a little bit about, A, what causes it and what you're doing with it.
Well, sleep apnea, we kind of joke about snoring and people have sleep apnea. It's almost a funny thing, do you snore, and we make fun of it. But it really is a very serious situation. If you are a true, one thing, 80% of people who have sleep apnea are undiagnosed. 8 out of 10 people who have apnea do not know it. And if you are sleep apneic, you have a 60% greater incidence of heart attack, you have a 60% greater incidence of stroke, type 2 diabetes, and so it's really a serious health issue. About 3 years ago, or 4 years ago, the American Academy of Sleep Medicine came out and approved oral appliances to advance the mandible that opens the airway up so that patients don't snore, but more importantly, that their blood level of oxygen doesn't decrease to a point that it gets a precipitation of plaque. That's what causes the heart attack. Well, I
want to ask you, you said 80% of people are untreated. I mean, if you snore, does that mean you have it? If you don't snore, are you okay?
No. Snoring is a symptom of sleep apnea, but you can snore and still be getting adequate oxygen into your lungs for your bloodstream, but it is the most common symptom of a sleep apneic. Unrefreshed sleep. Patient wakes up in the morning and they don't feel refreshed. They look in the mirror and they look tired and worn and drawn, and they're thinking, gosh, I'm getting old. And what it really is they're not getting REM sleep. If you're not getting enough oxygen, your body will sleep, but it won't sleep deep into REM sleep where the body refreshes itself. And so that's the issue. So we have an oral appliance. Did you?
I have something I wanted to ask you why most people don't go get treated. And I called a friend of mine who was diagnosed with sleep apnea, and I said, now, he doesn't wear this. He's diagnosed with sleep apnea. He knows he's going to die, he said, but he'd rather do that. This is what you get. This is called a CPAP mask.
CPAP.
I mean, I'm going to show everybody. I don't know about everybody else, but I don't know if I could sleep with this on my face all night. Plus, it's so sexy.
Well, let me say this. The CPAP is an excellent device if you can wear it. Well, but 8 out of 10 people can't tolerate that. So what
basically just blows
air up your nose, and so it fills your lungs up.
Off, you can't roll over.
Your alternative is an oral appliance that fits on the upper and lower arch, that has wings on it so that it advances the mandible, brings the tongue forward, that opens the airway.
Because my understanding is, in a significant portion of cases, it's the tongue falling back in the throat.
Yes, that's the biggest issue. There are other issues that cause sleep apnea, but that's the biggest one. We have instruments that will send sound waves into your oropharynx and map your oropharynx.
Well, now I want to ask you about that because I watch TV just like everybody else, you know, and I see these things that say, oh, you just put this in your mouth and you bite down and then it'll cure your snoring for one easy payment. And I thought, how does it, you know, it'd be like going to, for me, it'd be like going to the store and everybody got, for shoes, and everybody got size 6.
Right. What we do with our instrument, we advance the mandible and then we test it on the equipment to show us that the airway is open. You can be in any number of positions and airway not open, and you reach that critical point and all of a sudden the airway opens, snoring stops, air in the lungs.
So you actually custom fit that.
Exactly.
And then you use, and I mean, you showed me some of your stuff. You have all kinds of computer, and you use it to not only check the oral airway, you also check up through the nose.
The nasal as well. Yes.
All that's clear. So what would you say, how would somebody, if I wanted to, what would be a sign other than snoring, just being tired in the morning?
Well, unrefreshed sleep, waking up feeling sleepy, daytime sleepiness, morning headaches, or just...
What if I have one of these? Can I switch it for that?
You can.
In most cases,
yeah.
I can.
In most cases, you can go to the oral appliance.
Well, I couldn't imagine going through the airport with this. I couldn't imagine. He has like a case that looks like a like a sewing box case that he carries with him in this, and he said it's the most embarrassing thing. He goes to the airport and they pull him out of line and they yell CPAP machine, and because I think he's embarrassed the fact that he has it.
Well, the bottom line is you have two choices nowadays. You can do the CPAP. If you can tolerate it, that's great. If you're not, we can put you in a simple oral appliance. 85% success rate.
Do you have information about this on your website?
I do, on the website.
And it's drjolley.
drjolley.com.
Okay, let's move on, if it's okay with you.
Sure.
And talk about this joint. And this joint that, you know, and again, everybody here has had some issues with it. I had issues with it. Explain to me why, again, this joint can cause all the issues we were talking about.
Well, TMD is referred to as a great imposter. And that's because the problems in the TMJ joint are manifest in other places of the body. When you have a TMJ joint problem, when TMD, you can have headaches, neck pain, facial numbness, facial pain, numbness in the hands, vertigo, ringing in the ears, poor sleep.
It is diagnosed a lot as fibromyalgia.
It is. In fact, we have patients here that have been diagnosed with fibromyalgia, but put an orthotic in their mouth and they're just an absolute new person. I think, Flossie, didn't you have some issues with, they thought it was...
You did? And got rid of it. And they diagnosed you as...
Tell us a little bit about what was going on with you, Flossie, and then how the orthotic helped you.
Well, for one thing, I kept having a lot of pain in my ears, but also I kept having a lot of all in my joints and everything. And I ended up going to a neural doctor for the nerve, and he checked me, and they was running tests. But once I started seeing my dentist, things started making a change.
You told me earlier they almost knew you by name at the hospital.
And I went to the emergency room. I've been in the hospital so many times, went through MRI because I constantly had pain in the back of my neck and all up in my shoulders. I just constantly had, my blood pressure stayed up like 200 over 100.
And you're saying it lowered your blood pressure?
It did. It dealt with my blood pressure.
So how have you felt since the orthotic's been in?
Since I've had that, my blood pressure went completely a level. I'm back down to a normal blood pressure, 120/80.
Any more pain or the things?
I don't have no pain anymore.
Also, Diana had full all body pain. Diana, can you tell us a little bit about that?
Absolutely. For 3.5 years, I probably had almost constant pain, and it was upper body, shoulder, neck. Extreme tension would come into my joint. I would feel it, and then it would cause a migraine. And so it was 6 years ago I started going to the doctor for spasms and tension. And for 3.5 years I've aggressively tackled it and have gotten, actually had no relief. But I had the orthotic in my mouth for 1 week, and 85% of my pain was gone.
Really? Now, is that typical?
It is.
Does everybody have neck pain?
I don't mean to sound melodramatic, but it is absolutely a miracle. You put these orthotics in patients' mouth, and the